Hello everyone, I'm Dr. Santoshi Nandigam, Consultant Obstetrician and Gynecologist in Cadence Hospitals, Kodambakkam, Chennai. Welcome to my YouTube channel. In my previous videos, I've been talking about the different stages of labor, how to differentiate between a false pain and a true pain, what is a latent phase of labor. So, the next phase which follows latent phase of labor is called as the early labor. So, if I have to remind you what a latent phase is, contractions வரும் but ரொம்ப widely spaced இருக்கும். They are very irregular. They are completely spaced out, and the latent phase of labor for some patients it can last for about 24 hours, for some patients it can last for about 6 hours, for some patients it can last for about a week. So did I just say a week? Yes, I did. So latent phase of labor can be quite long and elaborate as well. So when your contractions start to regularize, that is when you start to feel your contractions every couple of minutes, let's say every 2 hours, which will eventually go down to every 1 hour, which will eventually come down to every 45 minutes, every 15 minutes. So that is your sign that you're actually getting into early labor. Your contractions regularize, they increase in intensity, they increase in their duration. Initially, when you first get your pain, it will last for about 10 seconds. Then as you progress eventually in your labor, as you progress into your early labor, the contraction duration increases. 10 seconds landa 15 seconds agala. 15 seconds landa 30 seconds agala. 30 seconds landa 45 seconds varaikku polam. Okay. So, early labor eppadi define பண்ணனும்னா contractions regularize ஆயிட்டே வரும். So for first-time pregnant mothers, the early labor can last for about a day or day and a half. But for the second-time pregnant mothers who've already delivered before, the duration of the early labor is quite short. Early labor la enna changes varlam. Again, the women might feel a little apprehensive and go to a gynecologist. And when they go to a gynecologist, first baby oda heartbeat eppadi irukku and check பண்ணுவாங்க. So CTG சொல்லுவாங்க, cardio tachograph. It's basically a machine which detects the baby's heartbeat and movements and the uterine contractions as well. Then the gynecologist might also do an internal examination. So internal examination பண்ணும்போது you can hear words like effacement and dilatation. Effacement அப்படினா என்னன்னா is like I've already mentioned in my previous videos. Effacement is basically softening and thinning out of the cervix. So if you see a cervix in your second trimester or the early third trimester, it will be like a tubular structure. Okay, it's like a tubular structure. Why does it have to be a tubular structure? Because we don't want the cervix to open before the due date. We want the cervix to open as and when it ripens and close to your due date. Okay, so as you progress in your early labor, the cervix will change its shape from the tubular structure. It will start effacing, it will start giving away for the baby's head to negotiate and come down. Okay, the thinning out of the cervix is called as the effacement. Then the second word you keep hearing from your gynecologist is the dilatation. Garbhapai vaai indha alavukku open aayirukkudu. So early labor involves the dilatation and effacement of the cervix, which are not there in your latent phase of labor. So latent phase of labor la periya cervical changes onnum irukadu, but early phase of labor la there are certain cervical changes. So like I've said, early labor can last for about 24 hours, they can last for about a day and a half. It completely depends on your body, the way your body is responsive to the hormones that are, trying to bring about the entire labor process. So early labor cervical dilatation ஆரம்பிக்கிறதுலேருந்து 6 centimeters of cervical dilatation வரைக்கும், we still call it early labor. Previously, the guidelines used to say, early labor is from the time cervix starts to dilate to 4 centimeters. But now it has increased. It has increased to 6 centimeters of cervical dilatation. So wait for part 3 of my series to know more about the active stage of labor.